It's a pleasure to be here today with you to be able to speak to you concerning an exciting new technology in wound care called closed pulse irrigation. CPI is essentially a hydrodebridement device used in wound care. CPI does meet the wound care challenges of today and as well as of the future. We are looking at treating many difficult wounds such as dehisced surgical wounds that are coming out of some of the orthopedic, neurosurgical, and general surgery portions of the hospitals. We are also looking at treating pressure ulcers, arterial ulcers, and venous stasis ulcers, as well as many chronic wounds that are occurring throughout our population. CPI addresses wound infections, and very importantly, CPI addresses the colonization and the formation of biofilm within the wound bed. CPI, or closed pulse irrigation, does increase patient safety as well as the safety of the facility and the safety of the physical therapist. We see that we can treat MRSA and other drug-resistant bacteria with CPI, which is becoming much more important in today's patient population. CPI improves outcome in wound care. It reduces some of the costs associated with wound care because we are eliminating the need to go to the operating room to actually perform debridement. And we are showing a much better return on investment for our facilities and for physical therapists. This new thinking in wound care really centers around the treatment of bacterial biofilms. These are a new way of thinking about bacteria within the wound bed. This new treatment, CPI, eliminates the bacterial biofilm without having to rely on antibiotics because it is a purely mechanical debridement. What we've been able to develop at PulseCare Medical is a system which will eliminate the bacterial biofilm due to the fact that it is a system composed of mechanical selective hydrodebridement. What this means is that we are using the mechanical means of water pressure to remove bacteria from the surface of a wound, and in addition removing the very difficult biofilm which develops in approximately 60% of chronic wounds. CPI is a patented treatment, and it is patented concerning its ability to totally contain the treatment for the patient and for the facility. We have also been able to eliminate suction during this treatment, and this greatly reduces pain that is associated with the normal open pulse lavage technique, which relies on suction. Now, I'd like to show you a little bit about the 5 stages of wound care, which I know you probably know a little bit about already. The first stage is the acute injury, where the wound is actually occurring on the surface of the skin. This is a point in the trauma where bacteria will be contaminating the open wound. So rapidly, we move from the acute injury into the inflammatory stage, and this is the stage where patients have so much difficulty moving through and getting through it. Because if your wound is stalled within the inflammatory stage, you'll find that you're neither going to progress towards the other stages of wound healing, such as the migratory, proliferative, and maturation phases of healing. What CPI does for the patient, for your patient, is it treats the inflammatory phase of healing, focusing on removing bacterial biofilm from the surface of the wound. And if you analyze many chronic wounds, they're mostly contaminated by Staph aureus. So solving this very difficult problem of moving through the inflammatory stage is what CPI is all about. This inflammatory stage of healing, which is necessary to move through, is really suffering from an increase of necrotic tissue and bacteria and biofilm on the wound surface. CPI can eliminate all 3 of these detrimental effects on the wound bed. And what happens is, once the bacterial contamination is removed, we see an enhancement of white blood cells and immune system and growth factors within the wound bed, which stimulate collagen. By moving through inflammation, we are able to develop a healthy wound bed which is promoting migratory stage of healing. And this then creates an environment in which fibroblasts, phagocytes, macrophages, and new capillaries can develop within the wound bed. And this is extremely important to wound healing and progression. The proliferative stage is the stage of healing that you all want to see in your patients. This is the stage when you start to see healthy, red granulating tissue develop within the wound bed. The blood flow is increasing, capillaries are increasing within the wound bed. We are delivering more nutrients and oxygen to the place where they need to be. And this is all due to the fact that we have decreased the bacterial bioburden within the wound.